You guys are in for a treat. Dr. Paul here. We've got a fresh 2-month-old baby. Hello, hello. How you guys doing?
Oh, we're doing good.
Awesome.
Yeah. We got a chunkalunk.
We got chunkalunk here. Look at those thighs. Look at those thighs. That's great. I'm gonna wash my hands.
Did you say hi? Did you say hi?
Did you say hi?
Say hello.
So,
oh, what is that?
We're 2 months old now, right?
2 months and like 2 weeks.
Okay.
2 months and some change.
Alrighty.
Yes, you do. Oh, look.
So, how's the baby sleeping?
She is a dream, baby.
Yeah?
They are
You got only eyes for mama, huh? You
No,
got
she
only eyes
sleeps
for
like
mama.
5 hours stretch. She
You
was.
do?
But now
You
it's
do?
like 9 hours.
Do you smile?
She
Do you
does.
smile?
You have to sing for her.
We have to sing?
Yep.
What song do we have to sing?
Twinkle, twinkle.
Twinkle, twinkle, little star, how I wonder. What you are?
I think so. I actually realized I don't know the song.
There
sound
we go.
like the birds.
Like the birds. I wanted to do a little bird. So one of the normal things for development for kids this age is, can they smile?
Oh yes. Oh, she's.
And tracking. She's already tracking the camera.
Yeah, of course.
You would have
Not-
kids who would just sort of go to the camera.
She's already up.
She's ready. You're ready. Hi. Hi
She
there.
actually laughed. We have a video of her
Oh my
laughing.
gosh. Fantastic.
Yeah, I missed it,
Are you
but
gonna
yeah, you
laugh?
got it.
Are you gonna laugh? Are you gonna laugh? Huh? You gonna laugh? So we're very attentive. We're tracking, so she
Yeah.
follows my eyes, so we know she sees real well. You're pretty sure she hears?
Yeah.
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 If there's a loud noise, she might startle.
Oh, she gets. Yeah, she gets.
We've got really good head control, so look at that tone. Oh, that's a big head to hold up, isn't it? Yep. Another way to look at head control and tone is to put her on her tummy.
Oh.
And there, look at that.
Who's that?
Who's that?
Ika.
Who's that?
Hi, Mama.
You haven't seen the kid in the mirror yet. Sometimes when they first see themselves in the mirror, it's
Check
so.
out that hair, sis.
It's look at that hair, dude. Oh, you got eyes for mama only.
Yeah.
Yeah.
Yeah, we're best friends.
You got only eyes for
We're
mama.
best friends.
Okay. And has she rolled yet?
She has not, but
She's about to.
tries to. Yeah, she
Like
wants
she's
to.
ready.
Yeah,
I'm just
she
looking at her. We're gonna get her first roll on camera.
Yeah, oh, that would be
Yeah, you're gonna do that. You're gonna roll for us. Oh, you know it's a little hard. So tummy time is something parents will ask about.
Yeah.
You can do briefly at this age.
Yeah.
Once she gets upset, no reason to leave her there being upset.
Okay. Yeah.
But you can start practicing. That's where you can start doing your push-ups.
What's the importance of tummy time?
Well, it's working on the motor skills, right? So they're lifting their head up, and eventually kids will eventually learn to crawl, roll, all those motor skills, which if you're just like this, it's passive. So you don't have to work on those muscles. I had one of my sons, telling on him, middle son, who we didn't do enough tummy time, I guess.
Yeah.
He just was happy to sit there for, 7 months before he rolled.
You know what though? With her,
That's-
I'm okay with that.
Yeah.
Yeah, I'm okay with
Keep you right where we put you. Yeah. Okay. So I'm gonna go get my equipment. We'll come take a look at you. Okay. Okay.
Say
I'll be right
okay.
back. I'll be right back. All right.
Say, I'll be right here. Oh my goodness. Say hi.
She's so pretty.
Say hello, see ya.
So how are the sisters doing with having a baby?
Oh my goodness.
I bet
Yeah, that's
you
interesting
got little mamas, right?
It's been hard.
Is
I'm
it
not
hard?
gonna lie. It's been
How
really
so?
hard.
Why?
So Layla,
Yeah.
the middle.
You don't have
and
to
you know-
share their names if you don't want to.
Yeah. Lulu. Yeah, she's having a really hard time.
In what
Like
way?
last night, there was big tears for all of
Because
it.
all the attention
Yeah,
you're putting to the baby,
yeah.
and she's like,
Yeah,
where-
and she's like,
Oh.
but she, so she like punishes me. And she's like, you're not my mom, I hate you. It's been hard, like,
Oh wow!
It's tough.
How old is she now?
she's 7. She's almost 8.
Yeah, usually you don't get that at
Yeah.
that age. So, remember, you're breastfeeding, right?
Yeah,
So when you're breastfeeding, that part of things, you're the only person that can do that.
yeah,
But anything else,
yeah,
hand the baby off
I know.
and give Layla some time.
Yeah, no,
Right.
we've been, and that's the thing, like, we've been doing that.
Yeah.
But she,
And then the other trick is, have her, you're together on the couch, have her holding the baby.
Yeah.
Picture of that up on the wall. there you are with your baby, right? So really kind of elevate all of that.
Yeah.
And to the best of your ability, just give her extra.
Yeah.
Yeah.
No, that's no. I'm like yeah.
Yeah.
I'm just giving it all.
Flu this year, for those of you who watch this, and the flu season's still ongoing, it's one of the worst we've ever had.
Yeah.
And interestingly enough, babies, especially breastfed babies, do very well. We've already looked at your eyes. You had normal red reflex, which tells us you don't have congenital cataracts. No, you don't. And you don't have other bad things of your retina. Things that are like, we won't even have to mention them here on film. So I'm gonna look in your ears. I know that's not a favorite thing. We're gonna look over here. Babies hate having their ears looked at.
Oh, she was.
That one's good.
Until you did that.
I know. Go doing that, Doc. What are you doing? So the ears look fine.
Yeah.
We're gonna look at your mouth. So under the tongue, I'm looking for the tongue tie, and her tongue moves. Look at that, way past her lips. That is way better than most these days. Now that. Yeah. So we're looking at the tongue movement. It's perfect. A very good question about that white on the tongue. So we're seeing. Hi there. Look at the tongue. It's white. Now, what we're gonna do, a lot of people will think that is thrush. I'm gonna get a tongue blade and just show you guys something.
Yeah.
You're so pretty.
So, if we look at the gums,
Yeah.
I don't really have a light. Here, I'll let you shine the light for me.
Oh, cool. Always like to.
All right, so we look at the tongue is white. See that? All right, we'll just go for the gums and shine the light a little closer. Over, put the light over here. There we go. You can see there's no white on those cheeks.
Yeah.
They're perfect. You can also look at there's a little whitish discoloration to the lips.
She had that when she was her first visit.
Yeah, but that's not thrush. And if you look, if there was thrush, which is yeast, right here where I'm putting this tongue blade, right here where I'm putting this tongue blade, it would be white, kind of like the tongue. And the white of thrush doesn't come off. Now, milk coating on tongues also doesn't come off because it's just been coating there for so long. Sometimes you can scrape and get a little bit, which I got a little bit, but I'm not worried that that's thrush.
Okay.
And explain what, you haven't even said what thrush is.
So Candida is the common yeast that kids will get causing thrush, which is a yeast infection by the organism Candida. So I'm not worried about it, but a lot of people would be.
We don't want to trick
This is
anyone.
perfect creases, leg creases. If you look at these creases, they're lined up. So you want them to be pretty even.
Why?
Interesting.
Because if they're not even, then you have either a hip that's not even or leg length that's not even. Are you smiling? Yeah, sometimes I can get babies to smile that way. All right, so we're gonna look at toesies.
We're learning all sorts of things.
Feetsies and toesies.
I'm gonna
1,
be a
2,
doctor
3, 4,
after
5.
this.
There are 5 toes. Hey, your heart is perfect. So are your lungs. Yes, they are. Yes, they are. You sound perfect. Yes, you do. I wiggle the legs so I can get deep into the abdomen to feel for masses. So that if there was a kidney mass or a thumb, oh, I'm sorry. If there were any masses, I would feel them. That's what I was doing. I know, I'm sorry. I could get pretty deep, huh? Then we're gonna check for femoral pulses because your heart, there it is, pumps all the way to the legs. We want to just make sure we got good pulses, and we do. Then we're going to check the hips if you don't want to miss a hip dysplasia. I am trying to dislocate the hips. Most kids don't like this, but you do. Yeah, because you're just extra special. Yes, you are. So the hip thing, we'll cover you up because it's kind of cold in here. If this is the hip socket, and here's your leg bone, if I can dislocate it, you got a floppy hip, then it will develop, this is the acetabulum part of your hip, will get loose. And then you've got hip problems the rest of your life. So it's a really important thing we check, and we got great hips.
Her hips don't lie.
So we have a perfect, healthy baby in every way. So what we have here is the blue line is average, and this is for height. So we've got phenomenal 75th percentile height. And we're gonna change the graph to weight. Similar trend. We're looking at that blue line again as average, 50th percentile. If you look at weight for height, it's 75th percentile. We are consistently doing great. And here's your head circumference. We've just got a large head. See that? 100th percentile.
That's right.
Yeah.
I make babies with big brains. Oh, did you not like that? Oh, how dare you, Dr. Thomas? She did not want you to have her
You're
head
taking
long.
after your doctor. I have a big head too. Yeah.
Big brain.
All right. You guys, thanks for watching. We've got a very healthy 2-month-old visit. I'm going to talk with Mom a little more off camera of how we can support her with what's going on with her other daughter who's struggling, and sort of kids this age. Doctors are supposed to make sure you're using a car seat. There's smoke detectors.
Oh, really?
Nobody's smoking in the
Car
house.
seat?
I forgot to tell you all that stuff.
What's that?
Yeah, car seat, no smoking in the house, functional smoke detectors, tummy time, and a lot of it's also supporting the family. This is a lot of work.
That's a lot.
For you.
Yeah.
So we're going to talk about that some more too. Make sure you have the support you need. And I want to thank you all for watching. We're going to have links in the description to the prior visits because this is part of a series. Big thumbs up. Share this video because this mom and this family is helping us educate you about normal pediatric stuff. So thanks for watching. I'm Dr. Paul.
See you guys later.
See you later.
Peace out. Peace out.
Peace out.